Advantage program is seeing premiums at a 13-year low, and in our Part D program, it's a 7-year low. But today I want to focus on nursing homes. In the scheme of life decisions, placing a loved one in a nursing home has to be one of the most difficult decisions. And when you make that decision, you want to know that you can stay connected with your loved one and that they're going to be safe and have the best quality of life. And that's why the decision to restrict visitation in nursing homes was a heartbreaking decision. And our thoughts and prayers are with the families and the patients during this very uncertain time. But the tragic reality is that the coronavirus seemed almost tailor-made to put major pressure on nursing homes. And countries across the world have struggled with their nursing home populations. But the president's early action around nursing homes has saved countless lives. And even before the coronavirus, we have been working on a strategy to improve quality in nursing homes. The strategy focused on quality, oversight, enforcement, and transparency for patients and their families so they understand exactly what's going on in nursing homes, about the conditions there, and reducing regulatory burdens so that nursing home providers can focus on providing care to their patients instead of paperwork. We've overhauled the entire survey system and implemented a common tool across the entire nation to ensure that our inspectors were being consistent, objective, and that's actually resulted in an increase in the number of fines. And we've updated our websites so that patients and their families have the latest information on the quality in a nursing home and making it very clear when nursing homes have had significant cases of abuse and neglect. And those improvements that we've made it possible when the coronavirus hit for us to take very rapid action on several fronts. We launched an unprecedented transparency effort, and that requires nursing homes to inform patients and families when there's an outbreak in the nursing home, and to also report that information directly to the CDC. And that's going to be important to our efforts around surveillance going forward as we reopen the country. And also, we increased reimbursement for labs so that they could do more testing in the nursing home. And that's going to be very critical, as I said before, to our monitoring and surveillance efforts. Also, starting in February, we issued a series of 9 guidance documents specific to coronavirus and controlling infections in nursing homes. And just for some perspective, normally these types of guidance documents can take months, sometimes years. But the CMS team worked days and nights and weekends to make sure we got this information in the hands of our nursing homes to do everything that we could to protect our vulnerable seniors. And we also host weekly calls with the nursing homes to help them implement our guidance. But federal action is just one part of the piece. States ultimately license nursing homes, and that's why we've been working with states to investigate outbreaks that have been going on and inspect nursing homes. And our guidance has called upon state and local leaders to support nursing homes in their efforts to control the coronavirus outbreaks. And I commend Governor Lee and governors across the nation that have implemented our guidance, whether it's cleaning their facilities, testing, and creating new COVID facilities. And that helps isolate patients that are sick and keeps other patients safe. And this work has been critical to keeping nursing home residents safe. And I'm pleased to announce that we are putting out new state grants to support state and local efforts to nursing homes. The president has been an advocate of this. He has asked for increased funding to inspect nursing homes every year in his budget, but this is the first time that Congress has provided this funding. And the money couldn't come at a more critical time when it'll be important to work with our state partners to ensure safety in our nursing homes. But the president has directed us to do more, and so as part of our Opening Up America efforts, we are going to oversee the Coronavirus Commission for Safety and Quality in Nursing Homes. And the commission will comprehensively assess the response. It will identify best practices and also provide recommendations for how we go forward to protect our nursing home residents and make sure we are providing the best quality of life. And in closing, I want to speak directly to our nursing home residents, their caretakers, and their families. Your pain is our pain, and we are doing everything we can to support you. And to the healthcare workers on the front lines providing care and comfort to our nursing home residents, we thank you. And thank you, Mr. President, for your consistent leadership and unwavering support for our elderly citizens. Thank you.
Would you want to tell them that we're going to have some big news very soon on insulin?
That's right.
It's a big deal.
We're doing everything we can to lower the price of insulin for our seniors, and we'll have some great announcements coming up very soon to lower the price.
Some big news, great news. Good, thank you.
Thank you.